Hello and back to Silvia's Health Hints. In this video I will talk about the private health insurance, how to choose a private health insurance if you go to Italy. I start with choosing an Italian private insurance because I have and had patients who choose to take a private insurance of an Italian company. It can be attractive as the costs usually are lower than for the insurances in other countries, but there can be some problems. In Italy, only recently it became more and more common to have also a private insurance. That's why Italians are not used to the way these insurances work. And also the insurances. The private Italian health insurances are designed for who has a public family doctor. They just don't think about persons who don't have a public health doctor, because in Italy everybody has a public family doctor. This means that most of them, this is my experience with my patients, cover only specialist visits and diagnostics, and this only if you've been referred by your family doctor. They don't cover private GPs and private family doctors, as officially in Italy something like a private family doctor doesn't exist. And here's the problem. So you pay for the insurance, and then you cannot go with the simple things to a family doctor, so you go to the specialist, but then the insurance doesn't cover this visit because you was not referred by a family doctor. The second problem is a very simple and practical problem. Due to the language barrier on both sides, patients and the seller, you know, when you go to the insurance and you ask for the insurance, you want to make the contract. This is what I saw in many of my patients, that they didn't understand completely the contract, that there was a lot of confusion. And only in case of illness or accident that required some diagnostic or treatments, they discovered that this and that was not covered. Very often patients ask me before they take an appointment for a treatment or something, they ask me, will this be covered by my insurance? This is a question a doctor cannot answer, because every insurance and every contract is different. This is something you can only see. Probably you have something written, hopefully you have something written, you have a list of which treatments and diagnostics and examinations exams are covered or not. So, or you can see it from your contract, or you need to ask. You need to call your insurance and ask to say, I have an appointment for example, removing the earwax from my ears. Will it be covered or not? So, I personally prefer. I would recommend more the insurance abroad, and I think that the best is to choose an insurance in your home country. It is something you should do as soon as possible before you plan to go for study abroad, or for working, or even for as a tourist. I mean, tourist is a little bit a different thing, because there are special insurances, for special travel insurances for a short period. So this is much easier, and this normally you do always in your home country. But for a longer stay, or if you move, I would recommend to do it in your home country, even if it costs a little bit more. It can also be helpful to ask at your university or private school if you are an abroad student, or your future employer if you go to work for a company abroad. Some universities or private schools and some companies have convenient agreements with insurances and will anyway recommend you an insurance. Sometimes they make like group contracts for all their students or all their employers. You also can ask other students and colleagues about their experience. You can check in social media groups for expats and abroad students. This is always helpful. When you choose a health insurance, consider your personal health conditions, what you will need. If you will need mostly, if normally you go often to a doctor, probably maybe because you are under treatment and you need to make regular controls, if you need certain specialists, certain laboratory examinations, things like this. So your personal health conditions. In case you are a family or a couple, how many persons you need to insure under your contract, how long you will stay abroad. You should pay attention that some convenient contracts don't cover, this is what I was talking about before, this is not only the Italian insurances. In general, you should always check if the insurance covers a GP, because a GP is the doctor you go mostly to. Some insurances cover only emergencies. They are normally much more convenient. The cost is less, but then everything you need to pay by out of pocket, and only if you really break a leg or have a bad accident and finish in the hospital, it's covered. For women, it's very important that a lot of contracts exclude pregnancy and birth, so pay attention to these details. And I don't know exactly if it's the same word in English, but I think it is internationally no franchise. This means that it's an amount of money that you need to reach before your insurance starts to reimburse. So for example, if this, sometimes it's even very high, this amount. For example, if it's €2,000 or $2,000, you need first to reach health costs of €2,000 that you pay out of pocket before your insurance starts to reimburse you. These are all small details to pay attention to when you do the contract, because very often, you know, ask many times the seller, is this covered, is this covered, how, give examples, do it, take your time to make these contracts, because there's nothing worse than being then in another country, going to the doctor and discovering that you need to pay everything out of pocket, and you thought that you would be covered for everything. I have some insurances I have direct billing agreements with, and this is very often the way I discovered that my patients were not covered for a GP or for certain things we did. And this was not a nice surprise for the patient. So, but at the end, if you do everything in time, and if you control the contract, if you ask the seller, then I think it is at the end possible to find a good insurance for yourself to be covered for a lot of things. Okay, so this was all for today. I thank you, like always, for watching this video and wish you a pleasant week. Thank you.